Words of congratulations to the new members for their eloquence, their passion, their well-informed arguments, although they're badly misguided. But I do congratulate them for being taking part in this spirited debate, and we welcome it. And I hope that someday we will be able to agree on both sides for us to engage in real colloquy between us back and forth. I think the American people and all members are well-informed. Madam President, I ask unanimous consent for the next 30 minutes to engage in colloquy with my colleagues.
Without objection.
And I'd like to just have a note. You know, I talk a lot about C-SPAN. I'm a great admirer of C-SPAN and how the president, at least when he was running, also believed in C-SPAN because he said C-SPAN would be in on the negotiations. There was posted by Politico last night at 5:48 p.m. a title, "No C-SPAN Here." The reporter said, right now a group of moderate senators is meeting behind closed doors to try to hash out a compromise on the public option. Reporters waiting for the meeting to break were just moved out of the corridor nearest the meeting and shunted around the corner, making it harder for the press to catch senators as they leave. C-SPAN, this is not. Well, the beat goes on. Could I just remind my colleagues of the amendment that we are discussing here is drafted to prevent drastic Medicare Advantage cuts from impacting all seniors in the Medicare Advantage. This amendment says simply, let's give seniors who are members of Medicare, who enrolled in Medicare Advantage, the same deal that Senator Nelson was able to get for the state of Florida, at least most of the seniors who enrolled in Medicare Advantage program. There are 11 million American seniors who are enrolled in Medicare Advantage program. This amendment would allow all 11 million to have the same benefits, and there would be no carve-outs for various groups of seniors just because of the influence of a member of this body. I just want to quote again the New York Times, my favorite source of information. They quote, Senator tries to allay fears on health overhaul. Mr. Nelson, a Democrat, has a big problem. The bill taken up this week by the committee would cut Medicare payments to insurance companies that care for more than 10 million older Americans, including nearly 1 million in Florida. The program known as Medicare Advantage is popular, et cetera, et cetera. It would be intolerable to ask senior citizens to give up substantial health benefits they are enjoying under Medicare, said Mr. Nelson, who has been deluged with calls and complaints from constituents. I am offering an amendment to shield seniors from those benefit cuts. I am offering an amendment to shield all senior citizens, the 11 million of them that are under Medicare Advantage, as the senator from Florida said, to shield seniors from benefit cuts. That's what this amendment is all about. We should not carve out for some seniors what other seniors are not entitled to. That's not America. That's not the way we should treat all of our citizens. And I hope that my colleagues will understand that this is simply in the name of fairness that this amendment is proposed. And I would ask the senator from Tennessee and the senator from Texas, at large numbers of enrollees in the Medicare Advantage program, also how this would be unfair as well.
Well, I thank the senator from Arizona for his amendment, and I thank the senator from Florida for his amendment, because Medicare Advantage is very important to Tennesseans. We have 243,000 Tennesseans who have opted for Medicare Advantage. About 1/4 of all Americans who are on Medicare have chosen Medicare Advantage because it provides the option for increased dental care, for vision care, for hearing coverage, for reduced hospital deductibles, many benefits. It's especially helpful to low-income and minority Americans. It's especially helpful to people in rural areas. And what the Republicans have been arguing all week is that, contrary to what our friends on the other side are saying, this bill cuts those Medicare Advantage benefits, and the director of the Congressional Budget Office says that fully half the benefits on Medicare Advantage for these 11 million Americans will be cut. Well, our Democratic friend says, no, that's not true. That's not true. We're going to cut $1 trillion out of Medicare over a fully implemented 10 years part of this bill, but nobody's going to be affected by it. Well, the senator from Florida apparently doesn't believe that. And he says, we have 900,000 Floridians who don't want their Medicare Advantage cut, and we don't trust, he is saying in effect, we don't trust this Democratic bill to protect these seniors' Medicare Advantage. So I would ask the senator from Texas, if the people of Florida and the senator from Florida don't trust the Democratic bill to protect Medicare Advantage, why should 240,000 Tennesseans trust the Democratic bill to protect Medicare Advantage?
Well, I agree with the distinguished senator from Tennessee and Arizona that what's good enough for the seniors in Florida ought to be good enough for all seniors. And in my state, the state of Texas, we have 532,000 seniors on Medicare Advantage. And they like it for the reasons that the senator from Tennessee mentioned, and they don't want us cutting those benefits. But I would ask the senator from Arizona and Tennessee, I seem to recall we had amendments earlier which would have protected everybody from cuts in their Medicare benefits. And now we have a targeted effort negotiated behind closed doors to protect states like Florida and Pennsylvania and others. And I wonder whether the Nelson amendment to protect the seniors in Florida would even be necessary if our colleagues across the aisle had agreed with us that no Medicare benefits should be cut under this bill.
Well, as the senator from Texas points out, just a few days ago, we, by a 100-0 vote, passed an amendment proposed by the senator from Colorado, Senator Bennett, that says, quote, protecting guaranteed Medicare benefits. Protecting and improving guaranteed Medicare benefits. Nothing in the provision of or amendments made by this act shall result in a reduction of guaranteed benefits under Title 18 of the Social Security Act. Is there any member on the other side that can guarantee seniors in his or her state in Medicare Advantage that they will not lose a single benefit that they have today? Not the guaranteed benefit that the other side goes to great pains to talk about. I think those who are enrolled in the Medicare Advantage system believe, since they received those benefits, that they are guaranteed benefits as well. And I'd ask we have our two physicians here on the floor who have both had the opportunity of dealing directly with the Medicare Advantage program. If you have a patient come in, you say, by the way, you're having your Medicare Advantage program cut, but don't worry, we are protecting your guaranteed Medicare benefits. You think they understand that language?
Well, I'd respond to the senator from Arizona with the following components. First of all, they won't understand that language. But more importantly, if you look at the law, there's Medicare A, Medicare B, Medicare C, Medicare D. They're all law. They're all law. And what is guaranteed under the law today is that if you want Medicare Advantage, you can have it. And what's going to change is we're going to take away that guarantee. We're going to modify Medicare Part C, which is Medicare Advantage. So we have this confusing state to say we're not taking away any of your guaranteed benefits, but in fact, under the current law today, Medicare Advantage is guaranteed to anybody that wants to sign up for it. So it's duplicitous at best to say we're not cutting your benefits when in fact you are. Let me just speak to my experience, and then I'll yield to my colleague, an orthopedic surgeon from Wyoming, is what is good about Medicare Advantage? We hear it's a money pot to pay for a new program for other people. Here's what's good about it, is we get coordinated care for poor Medicare folks. Medicare Advantage coordinates the care. And when you coordinate care, what you do is you decrease the number of tests, you prevent hospitalizations, you get better outcomes, and consequently you have healthier seniors. So when it's really looked at, Medicare Advantage really doesn't cost more. It actually saves Medicare money on an individual basis, because if you forego the entrance of a hospital where you really start incurring costs, what you've done is save the Medicare Trust Fund, but you've also given better care. Second point I would make, is many of the people on Medicare Advantage cannot afford to buy a Medicare supplemental policy. 94% of the people in this country on Medicare who are not Medicare Advantage are buying a supplemental policy. Why is that? Because the basic underlying benefit package of Medicare is not adequate. And so here we have this group of people who get benefited because they chose a guaranteed benefit of Medicare Part C, and all of a sudden we're saying, time out, you don't get that anymore.
So a preponderance of people who enroll in Medicare Advantage are low-income people, and a lot of them are rural residents?
A lot of rural. I don't know the income levels, but I know there's a propensity is that you actually get a savings